Hey fans, welcome back to the channel. I want us to talk about something important today, and that is about a sexually transmitted disease called chlamydia. You see, many people ignore this particular type of infection. They focus more on hepatitis, HIV as the only sexually transmitted disease. But chlamydia is a very tricky one when it comes to fertility, because chlamydia can actually affect your fertility. Now listen up, chlamydia can cause infertility in both male and female, not just for female. Now this infection is caused by a bacteria called Chlamydia trachomatis. This bacterial infection loves to live in area like your cervix in women. Now for male and female, you see your urethra, that's that urine tract. This bacteria loves to live there. Your rectum, that's the temporary place your body stores feces. This bacteria loves to live there. Now, what happens if chlamydia is left untreated? In fact, this is where it gets serious if you leave chlamydia untreated. Chlamydia is easy to treat, unlike all those viral infection like HIV, hepatitis. Chlamydia is easy to treat. But one thing about this bacterial infection is that if you leave it untreated, it can cause damage to your reproductive organs. Now, if you lady, listen up. If chlamydia is left untreated, this bacterial infection can move from your cervix up into your uterus and your fallopian tubes. This can lead to a condition called PID, that's a pelvic inflammatory disease. I know some of you might have heard pelvic inflammatory disease. I might be wondering what exactly causes this pelvic inflammatory disease. Is it chlamydia? Is it gonorrhea? Are one of the major bacteria that causes this pelvic inflammatory disease. I'm not saying that they are the only bacteria that causes it, but one of the major bacteria that causes this pelvic inflammatory disease. Pelvic inflammatory disease causes inflammations of your reproductive organs. It causes scarring of your fallopian tubes, and it can damage your fallopian tubes. The fallopian tubes is where fertilization occurs. Now, if the fallopian tube is blocked, or maybe there's a scar tissue there, the egg might not meet the sperm. And even if it meets the sperm, it might not reach the uterus. And when this happens, this can lead to infertility, ectopic pregnancy, which is life-threatening, chronic pelvic pains. Now listen up, untreated pelvic inflammatory disease is one of the leading causes of ectopic pregnancy. Yes, you heard me. Ectopic pregnancy, one of the leading causes of ectopic pregnancy is pelvic inflammatory disease. Although sometimes when ectopic pregnancy happens, there is no there's no known cause for it. It can happen without even PID. You understand? But when you have untreated PID, it causes scarring of your fallopian tube. And when this happens, the egg and the sperm cannot easily, when fertilization happens, cannot easily move to your uterus. It can get stuck in your fallopian tube, causing this ectopic pregnancy. And you know that ectopic pregnancy is one of the life-threatening pregnancy complication. And the worst part of it all is that some women don't even realize they have it. They only find out they have chlamydia when they have been trying for years to get pregnant and realize that they cannot get pregnant. Most people don't have symptoms. You could have it for years and feel totally fine. That is how tricky this bacterial infection actually is. Now listen up, amen. Chlamydia can lead to a condition known as epididymitis, that's inflammation of the sperm carrying tubes. This bacterial infection can cause testicular pain. It can lead to damage of the sperm. So yes, it can cause infertility in men also, not just for women, although it's more commonly a problem in women when compared to men. Now listen up, if you notice unusual vaginal discharge, or maybe burning sensation when you urinate, or you notice lower abdominal pain like pelvic pain down there, and the pain is cruciating, even if it's not cruciating and it keep coming back, or you notice pain during sexual intercourse, unusual bleeding, maybe after sex, you don't have to keep quiet. Now listen up, if you're sexually active, it doesn't matter if maybe it's only one partner you are faithful to for years, or maybe you have multiple partners. It doesn't matter. As long as you're sexually active, it's advisable for you to go for screening tests, all these STD tests. Now, it doesn't matter if your partner has been faithful to you, because Your partner might be faithful to you in that relationship of 1 year, 2 years, 3 years, and maybe they already have this bacterial infection even before they met you. So it is advisable for you to run this test. So women only find out that they have chlamydia only when they realize that they couldn't get pregnant after trying for years to conceive, and it's not something funny. So if you experience any type of unusual discharge, painful urination, it is advisable for you to go for a screening test. Tell them that you want to run a test on chlamydia. Just go to any lab. This is very, 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 very important. Now, if you find this video helpful, don't forget to give a thumbs up, like, subscribe, and share. Bye.